Now I want to discuss two topics with you. First, how to draw a pedigree. Second, how to analyze it. What the key feature of how to analyze. So when you draw a pedigree, I start with the affected person, which is called proband. Like if a male come in OPD with the problem of bleedings since birth repeatedly, and you start with the child, and so how it linked with the other family members. So after that you will make the offsprings of that parents, other offsprings are normal or normal. Then you need to chronological order. He is the eldest, second number, and that third one male, again he affected the same. So first then after that you need to make the how the parents related to each other, which you can only make when you make how their maternal and paternal sides parents link each other. So you need to make three generation pedigree minimum for a scientifically well understanding pedigree, and you make how much their brothers, sisters of paternal and maternal sides, and how their offsprings, they are normal or affected, or if you don't know the exactly the numbers and sex, you can make diamonds and put the numbers of children's. In the same way here you can also make male, how much male they have and how much the females others and their children too. Anyone is how much affected he, if she has the sisters and affected with the same problems or not, any super problems. Here you will put the date and you construct it, your sign, and here the last is the key. What mean key here? You will make the different coloring of every, or make a corners which make a sense what the meaning of that. Like this, if I make the corner of these two, we need to make the mention what is the meaning of that. What is this? The bleeding, or you need to mention the age is 39 year old, she is 37, and the age of the affected peoples 10 years, 7 years, 5 years, and here you use the Roman letter 1, 2nd, and 3rd. If they link something, you need to mention the mother, father, parents, how relate to each other, how they consanguinity, additional one more lines. The main points you need always to take care, make the three generation pedigree, mention the province, this case first time diagnose and come take consent from you. Second is you need to make the mark on the key, and their mark or the meaning of that, what you make something. Here is something you may make that their lower half, then you make it is different key of the marking is MR, meta tradition. Put the date and the signatures who made it, and on the Roman letters you make the generations. So there I mentioned on a few of them, but exactly there are many others. uh, the key points of the pedigree symbols which you use, like if you make the two males, if you cut like the disease male, you make the color whole if the only one key features you want to denote it, and key if there are multiple features you can divide in multiple portions as I show you. So you then affected by history, they are not confirmed, doubtful, examine males, and this is uh, identical twins, is their links and they are fraternal twins, or we don't know exactly the genotypically. You can make the question mark. It's still adopted males, and the for female the same types, and the point of point is showing carrier, examined female, and again the same, and these are adopted females. Some other is used like sex unknown, lived one day, very smaller size. Actually is not too much commonly used. Miscarriages is actually is not denoted only by this. They are the exactly they use nowadays these symbols. Miscarriages, what the meaning if you cut in the middle, that is induce abortions. Oh sorry, oh this is abortions. So miscarriages are correct, and this is the abortion meaning. This is induce abortions, and that is spontaneous abortions. So that is miscarriage is correct, and that is stillbirth, that is a pregnancies, and you don't like to denote the sex the same, you put the p. Marriage, two lines, one line is marriage, second line they already have some link, so consanguinity is denoting the two relationship. Daughter like extramarital affairs. Divorce, you got it, no children is make to dot like this way. And how do you analyze after that? Making a pedigree is the most important things. You just focus on a few factors which I mentioned here. You need to check it is consanguinity, they are more hit toward the autosomal recessive, but not the rule of thumb, as we think consanguinity is increased autosomal recessive disorder not happen always. Consanguinity is make the homozygosity is even autosomal dominant, so mild autosomal disorder is more obvious to have clinical phenotype, severe phenotypes, and easily diagnosis. And beside that, the X-links also, most of the consanguinity disorder is more severe. When it's perspective, when the parent are normal, it will make you think autosomal recessive more. When the transmission is vertical by 3 generations, you will go direct line. The vertical transmission is 1, 2, 3, all generation effect is called autosomal dominant, you think more. And the recurrent abortions, which make you hint some type of parents of the balanced chromosomal rearrangements. Don't fit to anything, is you are more near to non-Mendelian type. If the X links only male affected, and from male to male there are no transmissions, you think it is X-linked, which is a key feature differentiating from autosomal dominant. Thank you.